Okay, I think we're ready to go. So, good morning, everyone. Good morning. This is the OBSWA podcast, our Friday OBSWA podcast, which we run every Friday. Today, we are going to be, today is March 20th, 2026, and we're going to be doing a different podcast. It's called Medical Cannabis 101, What PSWs Need to Know. I'm Ian De Silva, COO of the Ontario PSW Association, Canadian Support Workers Association, and I'm joined here today graced by the gracious Dr. Paula Williams, who's a physician at Apollo Care. Um, I'm going to read a bio if that's all right, Dr. Williams, if you don't mind.
Okay.
Okay. Dr. Williams is a physician with broad clinical experience spanning decades of internal medicine, anesthesia, family practice, and pain management. After completing her first degree, she spent 2 years volunteering in East Africa before earning her medical degree at the University of Toronto. She went on to complete 5 years of postgraduate training in anesthesia and internal medicine. While raising her 4 children, Dr. Williams transitioned into family practice and pain management. Something we know about. While working as an interventional pain clinic and later in her own practice, she became increasingly impressed by the therapeutic potential of medical cannabis for patients with chronic and complex conditions. Dr. Williams has been affiliated with Apollo Cannabis Clinics for over a decade, and in recent years has focused much of her work on supporting families with autistic children. Can't think of anyone we'd rather be speaking with this morning. Dr. Williams retired full-time practice in 2021, but continues to see patients at the Apollo part-time. Proud grandmother of 6, brings a thoughtful, patient-centered approach to her ongoing clinical work, and notably has never used cannabis herself, grounding her practice in clinical observation and evidence-based care, which I think is vital for this conversation. Thank you for joining us this morning.
It's a great pleasure. I love
Thank
talking
you.
about cannabis,
Yeah,
medical
well, that's
cannabis.
it's a new topic for us, so we're going to go through several discussion points. I'm just going to ask some questions, and because this is somewhat new to this profession, we're just kind of doing this as an introductory, hence the Cannabis 101 approach. So, discussion point one, medical cannabis 101, the basics. In simple language, what is medical cannabis? What's the difference between medical, recreational, cannabinoids? Take us away, Doc.
Okie dokie. Everybody knows what cannabis is, but we know over the centuries people have figured out that it has some very useful aspects to it. And they have worked out that there are over 500 different chemicals in a little cannabis plant, out of which 140 are cannabinoids, that means that these cannabinoids act on certain receptors in the body, which are all over the body, called endocannabinoid receptors. And they can be very useful in managing how the body deals with pain, mood, sleep, temperature, inflammation, hunger, nausea. They don't all do the same thing, but sometimes they actually work better together. So for medical cannabis, we've kind of sorted out two main types. CBD, which is cannabidiol, which is the maybe the most useful kind for us. And then THC, tetrahydrocannabinol, which is the kind of molecule that could make you feel high or stoned, but it has other really useful things that it does. It's very good on pain, it's good on sleep. So medical cannabis is cannabis that in Canada we access from a licensed producer, and that's a company that's figured out how to purify the cannabis and make the two different types and different combinations and gets it approved by Health Canada. So we only deal with cannabis that's approved by Health Canada, not the kind of thing that you could buy out in the street under a bridge where somebody is smoking it and has a bottle of booze beside them. Not that. And it doesn't have any impurities in it either. And so what they've done is they've made it into different forms. So for medical cannabis, we'd rather not use the smoking form, which is they call the flower, the little plants that you would put in some kind of smoking apparatus. We're not terribly keen on vaping it, but that can be done either with the plant or the oils. What we really like is medical cannabis in the form of like a little jelly capsule or a gummy or an oil. The downside of the oil is it can be a bit stinky, but they're working on that. So when we prescribe medical cannabis, we're out to get CBD, THC, and figure out for each patient what form they'd like to take it in. And we will definitely be pushing the oral forms, the edible forms, that kind of thing. Uh, and it's actually pretty easy to take. It also comes in a sort of topical form, and the PSWs might be interested in this because you can put it on sore joints of people who have arthritis and that. So we'll get into that later. So you can get a kind that you just rub on, and you can get a spray form, and then there's a few other really weird forms. So most of the patients that we are dealing with should not be smoking cannabis, but in practice they might be. They might be smoking other things too, and we'll have to think about that. So I came up with this statistic. Apparently, 27% of the Canadian population has used some kind of medical cannabis. It might be just something they borrowed from a friend or something they got in a drugstore. Apparently, you can buy the stuff in a gas station in Florida. It's so common because all the seniors in Florida have arthritis and they love CBD, but we don't have that. So it's actually quite common that people have heard about it and given it a little try. And so the safe thing is to get the medical form. So in Canada, medical cannabis is legal. It is legal for any age if it's medical, if it's prescribed. And medical cannabis is prescribed by a doctor, can be any doctor, and accessed from a licensed producer. So other cannabis is legal if you're over 18. So you'll see that we prescribe to children, to teenagers, because for medical, there's no age limit. It sounds a little bit scary, but I'll tell you a little bit about this later. It's brilliant. So the other thing about medical cannabis is once you get your prescription, you have to buy it online from a licensed producer. You have to order it online and it has to be shipped to you. So you don't go to a weed shop, cannabis store, of which there's one half a block from you right now, and two or three of them, and within half
They're
a mile
everywhere.
radius. They're everywhere. You don't go to those stores because if you're buying that, it could be okay, but it's not medical. And the way we do it at Apollo Clinic, we make it very, very easy for patients to get it, except for the fact that they have to pay for it. So the way you get it, if through Apollo Clinic, is quite good. They've been doing it for over 10 years. A doctor writes an electronic prescription, and Apollo Clinic sends it to one of the licensed producers, and the licensed producer talks to the patient or their caregiver and says, okay, what kind do you think you'd like? The prescription will just say how much you can order per month. And it's almost arbitrary. For me, it's always going to be more than you need. It doesn't have a dose. So our clinic looks at the prescription to see what the doctor wrote, and we have these educators who are younger people, and they will work out a sort of titration plan for the patient. We start with a very small amount, you work up, and once the patient receives it, they'll help them get going on it. And at Apollo Clinic, we also follow up every a couple of months, see how the patient's doing. And the educators and the doctors are very approachable. The patient can email them and so forth. But actually, any doctor can write the prescription. And you just have to tell the patient, don't take this over to the drugstore and demand your weed. It's not going to work.
It's a separate system.
Has to be online. So I've had people who didn't understand this, and they went to Shoppers and got really upset.
Yes.
Anyway, so it's actually not hard to get, but you have to know how to do it. So as PSWs, you'll have people asking about it and families asking about it, and that's how you do it. There are other clinics as well as Apollo Clinic. Our gimmick is there's no charge to you because Apollo Clinic actually doesn't sell cannabis. It doesn't. It's funded in a different way, partly by Ministry of Health and partly by another company. So the patient doesn't have to pay anything to get it, but to actually get their hands on it, somebody has to pay for it.
Well, that's the way it is. it is in that that's not new to any of our members here, not to worry.
Yeah, yeah.
Excellent. So
Um,
I'm going to jump ahead a little bit. So because a lot of our PSWs, because of this event, and because you've identified how Apollo Clinic does this, so a lot of our members have chronic pain, arthritis, neuropathic pain, sleep issues, anxiety, PTSD, palliative care. How do how does the cannabis, would you say medical cannabis, support some of these conditions, and when is it appropriate?
okay, so right away you think of pain, think of arthritis, neuropathic pain, multiple sclerosis. But you're right. Patients that you care for and the PSWs themselves
Oh,
may
yeah.
have issues with sleep or anxiety. In the clinic, we used to see a lot of people with post-traumatic stress. They might be paramedics, soldiers, but interestingly enough, a lot of cancer patients also have post-traumatic stress, had terrible things said to them. There are people who are dying from cancer or other conditions, might be in a lot of pain, might be scared. Um, I've also found it very useful for inflammatory bowel disease like Crohn's disease, this kind of thing where it's just super painful. And other things that have come up that you may not actually have thought of is we use it a lot for children with autism. That's my favorite thing at the moment because it's the most gratifying thing I've ever done. For some reason,
Love to hear
cannabis
more. Yeah.
helps them.
Tell us about that a bit. Like that's I
Yeah.
love to.
Yeah. And you may well be caring for a family with a child or a young adult who has autism. It doesn't go away. It's there for the rest of their life. They may have a mild condition where they just have a little trouble getting along with people, or it may be very disrupting. The child may be violent, hurt themselves, hurt other people. I'll be talking to someone on the phone and their child is biting them or smashing their head into the wall. These children are very uncomfortable in their lives. They're very hyper and they may or may not have speech. And it was amazing to me to find out that cannabis, it can be very calming for them. It makes them feel more comfortable in their bodies. They stop being violent, they stop hurting themselves. Sometimes their speech loosens up a little bit. And I'd say about 9 times out of 10, the next time I talk to the parent, they say, it was like night and day. I could send my child back to school. Sometimes it just doesn't work, but the amount of times it does work are extraordinary. And the nice thing about medical cannabis for kids is it's extremely safe. So I should point that out that CBD, cannabidiol, which would be the main one that PSWs will be dealing with, is a very safe substance. It's not psychoactive. You cannot get high on it. You can't be addicted to it. And it doesn't do anything bad. It's not like other medications.
Deny.
And the worst thing it would do is you might feel a little upset stomach or dizzy. The THC component, you got to be a little more careful. Could be dizzy, um, could be stoned, but you definitely want to stop your dose if that's starting to happen.
Yes.
So these are common conditions. I think pain is probably the main thing. And you're dealing with often an elderly population that's very frail, that falls all the time, that's maybe lost some weight, not doing well, lonely, family is not really there for them. So that all has to be assessed and considered. So those are the main things. There are people with mental illnesses who feel they do well on cannabis. The literature is for and against, it's all over the map. But we just do see a lot of people feeling less anxious and sleeping better. The autistic children definitely sleep better because without it, they're up running around trying to get out of the house, and the parents have locks on all the doors and windows, kind of thing. So, situations in life that you never imagine, but they deal with very well. I found with the autistic population, the parents are very knowledgeable. They've talked to other people, they've joined Facebook groups, you know, they've done everything they can to find out what's best for their child. And their worst problem is dealing with their own doctors who, are likely to say, "Oh, that's dangerous. You would never do that. You're crazy. You don't know what you're doing." So their own doctors are often not informed, and
Yeah,
so they won't tell the doctor that their child is taking cannabis. They'll sort of sneak it in, and the doctor thinks that they're the one that caused all the benefit. Anyway, so I think personal support workers will come across this very often, and you'll find that families are starting to know about it. They might ask you, you might be in a position where you said, I'm caring for another person who has arthritis and they use this, and the problem for the patient will be getting it past their own doctor who may or may not be hostile or who may not care. And because I worked in the world of pain management for many years, I know a lot of family doctors are clueless when it comes to pain management. They just don't see it. And it's so important. And
strange that they
and
are.
as specialists in this field, we've tried lots of things that weren't great, didn't work, caused trouble, narcotics being number one. Tried all kinds of things. And this is the best thing I've ever come across. It rarely causes trouble. So, something you can keep in your mind when you're dealing with the people you're taking care of. And these patients have a right to have their pain dealt with. You know,
One
it's
of the
no good.
principles of being a PSW is DIPPS depend. You have to have preference, and if that's what they want, then you have to make an effort to provide that. Sorry to interrupt. Please
Yeah,
continue.
yeah, okay. Well, as you know, you have to be aware that they may have pain that's not being treated, may have anxiety, uh, all kinds of things that are not being treated. So let me see, where did I get to here?
We are just going to go on to the role of the PSW. I think we're transitioning nicely because we
Yeah.
touched a little bit about, yes, the PSW, and to touch on that point, PSWs are often in a position to discuss things with family and make recommendations for them to explore. So that is absolutely correct and brilliant. I think we want to
Yeah.
look at the PSW scope when supporting a client who uses medical cannabis. So what can they do? Like PSWs have, there are things that they can't do. So can we talk about what they can assist with, documentation, storage?
Yes. Yeah. The main thing is knowledge, and you're getting a little bit today, and you can get more. If you go onto the Apollo website, there's all kinds of little sections on different aspects of cannabis. So you can learn about it, you can watch their videos. Um, so you can go after the knowledge gap. A PSW, as far as I know in Canada, may assist with administration the same as any other medication. There has to be a protocol, particularly in a nursing home. And long-term care facilities, some of them are now setting up the protocols for handling medical cannabis because you have to be careful. They might be smoking something else that bringing it in that you don't even know about. You don't want them smoking and, upsetting other patients nearby. There's all kinds of things that could go wrong. So a protocol will be set up, has to be stored safely. I've seen people who said, nobody can get my cannabis because I've got it right here in this little locked box right here. Here it is. And I said, well, someone could take the box. Oh, so and so just locking it up, not good enough. Um, it, it has a certain value, financial value, so it could be stolen. So the protocol has to be set up by the long-term care facility. And if you're in a private home, the same thing. You simply have to have a setup with the family so that the supply is safe, and the administration has to be done by a protocol. You can't change it. You can't say, well, I think he needs a little more today. As a PSW, you can't do that, but you can discuss it with the family and or with the doctor, whoever is running that. Because it's legal in Canada, it's basically you can take it if you want, but you're often in charge of people who shouldn't really make those decisions. They might be a little demented, or they might be confused, anything
Yes.
like that. So you have to remember that this is basically is a very safe substance, not a narcotic. but you do need a specific care plan. And after you get onto it, it can be kind of flexible, you know. We don't have precise doses quite often because there just aren't. Even for the children, eventually you just settle on something that seems to work well. And the doses for children, I should point out, are very tiny. They don't need much. Um, you keep in mind side effects that could occur. Uh, the main one is if there's THC in the product, you don't want the older person becoming dizzy or unsteady on their feet or falling.
Of course.
But you would be doing that anyway. So I think the PSW needs to be able to explain to the family that they understand what they're giving the patient, and they're happy with it, and they have backup if they need it. If you're not sure, you can get hold of the Apollo Clinic, whatever clinic you're dealing with.
Absolutely.
And the other interesting thing about the cannabis is if you have a patient who is already taking a whole boatload of painkillers, things like that, they sort of tend to back off those painkillers. And we've had a couple studies that showed that they just slowly stop using their narcotics and they may even come off them. And alcohol, the same. They may use less alcohol. Alcohol is tricky because it's not hard to get and people stash it places, but they don't seem to need it as much. And I think that's a great benefit of medical cannabis because you're pretty safe with medical cannabis in your system, but you're not safe with a whole lot of narcotics in your system.
It's
So
almost like the cannabis takes the stress off the body, hence that the body doesn't need that. You're not under stress, so you don't want some of those things anymore. Maybe
yeah,
something. I don't
yeah,
know. I'm speculating.
I think that's true because people do feel better on it. The goal with medical cannabis is not to feel like super happy on it, just to take away your pain and help you relax. Um, I'm sure it does other things as well because, like I said, I never tried it, but people seem to like this stuff. But the cannabis that people use normally would have a lot more THC in it, you
It would,
know.
yeah.
Yeah, yeah.
So
So
I
we
think this,
we we're not keen on that.
let's
Um,
go into them because we've kind of touched on this now. We've talked a little bit about side effects, but I want to jump into a little bit about misconceptions because I think the real issue, the issue that we deal with when it comes to introducing this topic to our PSWs is exactly what we've highlighted. It's very easy for anyone in Canada once you turn 18 to self-medicate, go explore all these different things, dabble if they want to. But there's also a very significant difference between medical cannabis, which is a far more controlled process, a far more scientific process, and it's all strictly patient-centered. So I want to make sure that we just understand that for our audience. That's really what the two systems that we're talking about. So um, let's talk about misconceptions because there's stigma about cannabis still.
yes,
You see that in long-term care. You see that everywhere in our society. So let's talk about that if you don't mind.
yeah. I think almost every time I propose it to people, their image is of an older person lying back in a chair smoking weed and in a cloud of unpleasant smoke,
Oh,
on the
great.
wards.
Yeah.
And we say, no, it's not being used for that purpose. We discourage people smoking. We don't even like vaping. It's not addictive. They're not going to be dependent on it. They can start it and stop it. It's in your system. It's out again in 6 or 7 hours, gone. So it's pretty good as a drug goes because you just don't have the craving for it. Being addicted to it has happened. It doesn't seem to happen in the populations we're dealing with so often. People who abuse substances are more likely to abuse it, and they're not. We would be screening for that when we go to do our prescriptions.
Yeah.
But you'll know who these people are. But being addicted is not very common. It has happened. Um, I haven't really seen it happen in the last 10 years in the patients we've prescribed to.
Doesn't
Uh,
addiction tend to happen more with opioid receptors and opioids with that? Because
yeah,
because
yeah.
cannibal is a different interaction
It's
with the nervous
different
system.
pathway. Yeah. It's in this endocannabinoid system, which is all over the body. But there's just it doesn't operate along addictive pathway.
Where I
People who are addicted are just thinking about their substance all the time. They got to have it. They got to get some more. If you can't get more cannabis, well, you can't
the
take a
life moves on.
Tylenol.
Yeah, it's fair enough.
Yeah, yeah.
Sorry, I just wanted
So
to say that.
the main stigma is that people don't know about the safe use of cannabis, you know,
Yes.
and
Good.
I think that's it. And the doctors, like I said, they're big offenders. And also, people might not know that older people can use it safely. We would be screening those people to know if they're frail, fragile, demented, or whatever, if there are any contraindications. And also, when we do our prescriptions, we are knowing what other medications they're on, because there are a couple kinds of medications that interact with CBD, for example. So we have to know about that. Um, and the people you'll be dealing with in long-term care, you've got lots of people around you to help care for them. But if you're just going into a home and caring for somebody, a lot of the time during the day, that person is alone. So you have to make sure everything is as controlled as you can get it. And patients love to know about it too. They love to have information about it.
Well, yeah.
Yeah,
Knowledge is
yeah,
power. I think everyone's in that situation.
yeah. So I think we should think about the things to keep it as safe as possible. That is, control how the supply is kept, follow documentation, dosing protocol, that kind of thing. Uh, Things you would look out for would be unsteadiness on their feet, that is more than usual, excessive sleepiness, dizziness, and in patient in the home may be using other substances of all kinds. Um, Actually, I had a patient about 20 years ago whose daughter wanted to get out of the house in the evening, so she was slipping her barbiturates. And they didn't find it till she was taken to an emergency unconscious. It's like
Whoa.
sedatives. I don't know where she got it because we don't use those drugs anymore. But that's an extreme case. But your patient may be using a whole slew of medications. The ones you're looking out for are warfarin or Coumadin. Not that many people on it anymore, but there's a few with heart valves, and sometimes some anticonvulsants, like valproic acid, that sort of thing, risperidone. We find the autistic children are often on a whole slew of medications that are just awful for them because there's nothing really designed for the autistic child. They often have ADHD and anxiety. So their poor doctors say, well, we got to have some, Vyvanse here. We're going to have the risperidone for the bad behavior. We're going to have a sleeping pill, and they'll have like 8 drugs they're on. And again, the parents often slowly wean them off. But so we really have to know about what other drugs they're on. And there are occasional people who just can't take it, can't take CBD. Their body just doesn't handle it. They feel dizzy. But on the whole, is very, very safe. Um, Studies have looked into this and found that there has never been a death attributed to CBD for any reason. It just doesn't do that. So that's kind of good to
I
know.
consider a 0% death rate a very good thing when looking at a pain
Yeah,
relieving option personally,
yeah,
compared to like Percocets and things that have these
yeah,
critically bad
yeah.
effects. Yeah,
And
I don't consider that's amazing.
and people get hold of all kinds of other substances, but alcohol is probably the worst. Not a
Yeah,
big fan of alcohol either.
no, not me either, actually. So
Yeah.
that's me. So keeping it, so just tying this back then, because really looking at medical cannabis as a medical prescribed, this is a very strict process. So it's important to be mindful of drug interactions. And when do we escalate concerns? So when do you think as a PSW, someone's taking CBD, when would one escalate a concern?
Well, say their medication changes and they're suddenly put on a drug they weren't on, or it's basically if they're dizzy, or they're falling, or they're too sleepy. You know, there isn't too much else that can go wrong with them, or acting high. Um, occasionally would happen. Because sometimes the THC is used because it's a little bit better for pain relief. You don't need too much, and it's better for sleep. Or the patient may be using some that they got from somebody else that you didn't know about,
Yeah, that's the
They,
risk. So
that's
they
a risk. Yeah. They
right.
have to be able to tell people what they're taking. Yeah. And
So the next question, let's go into access and we have two more areas I want to cover: access and affordability. So let's talk a
yes,
little bit about the money. This is so PSWs might not realize, for example, that medical cannabis requires a prescription. But we've talked a little bit about the Apollo being free. Can you tell me about what a health spending account is? That one I'm not 100% on when it comes.
yes, yeah. So some you have to buy the cannabis, and
Yes,
it's not really cheap, but most drugs aren't. So we tell people if you've got a private drug plan, if you're covered on a drug plan like from your union or your workplace, the health spending account is the area that um, in which you might have, say, $500 a year to spend on massage, physiotherapy, orthotics, that kind of thing. So a lot of those plans will cover medical cannabis. Some will cover it for conditions like multiple sclerosis, cancer pain, outright straight coverage. A lot of the plans they're sneaky. They don't cover. They find ways not to cover it. Ontario Drug Benefit doesn't cover it. ODB, seniors ODB doesn't cover it. So people come in, they say, "Well, is OHIP paying for this?" OHIP doesn't pay for any drugs, and unfortunately, if it was up to me, they'd cover everything. But uh, somehow it has to be paid for. So you can approach your drug plan. If not, all you can do is claim it on your tax. It's tax deductible because it's a prescription. So Canada Revenue Agency considers it a tax deduction. So the children I see with autism, these poor parents have huge number of expenses, and they can always claim it because they get past that minimum.
yeah, well, absolutely. It would be a
Yeah,
non-refundable tax expense.
yeah, that kind of thing. So it's some people simply can't afford it. Some of the licensed producers have programs for children or compassionate programs. Sometimes there are discounts. What I find is that it changes all the time. Maybe they had it last year and this year they don't. So Apollo Clinic, and I'm sure the other clinic, have these educators and they figure it all out because I've totally lost track of what company has what. I have no clue. And I have to say, the educator will find this for you. She will find a company. She will find the kind you need. Uh, the other thing that sometimes covers it is car insurance. If you're in a car accident, um, you can often hit up the insurance company to pay for it if prescribed. You might need a lawyer for that, but if you're at that point, you might have a lawyer.
You might.
So Apollo Clinic, I think they will actually help people with that. They've got some guy who helps you get that cost covered. But there are people who can't afford it at all.
Yep, no, that's the truth. And I know that I've heard that there's some companies will offer if you can show them income statements and they can reduce costs. I've heard of that. I don't know if that's still around. But I do remember hearing about that in the past.
Yeah,
This is and I think this ties in a lot to well the PSWs themselves. So we've talked a bit about what they can do as advocacy for their clients, bringing awareness to this as a medical from the medical point of view. But the PSWs personally, our members experience chronic pain burnout. Um, can a PSW take is medical cannabis appropriate for healthcare workers themselves? What conditions would qualify, and what does the process look like? So I'm a PSW. PSWs get lots of injuries. It's the most dangerous field in Canada to work in, but they're really on their own when it comes to dealing with the impacts of the system that injures them. So
yeah,
what can they do?
yeah. I agree. They're on their own, and
They
they
are.
and
They have
and
us. They
they're
have.
they're very brave people, and they will work with a lot of pain, a lot of stress that I think they shouldn't. They should have help with this. So I think the first thing is that they should have appropriate care for whatever condition they've got, whether it's pain or anxiety, burnout. They need all the appropriate care that there is. I think they can use cannabis. But the important thing is to remember is that you should not take care of people or drive a vehicle or operate a machine or something if you are inebriated rather.
Yes.
If you are stoned or high in any way, you should not be doing this. So I think you can use medical cannabis under certain conditions. It has to be a medical one, documented, and you should not have THC in it such that you are unable to function safely. And I think that you'd want to clear it with your workplace. A lot of places will check your THC level, and that might be happening to you too. You may be asked to give a sample of some kind. I don't think it's that useful, but they do it. Um, I think they should not be treated as if they're doing something wrong or illegal. I mean, it'd be much better to come to work with CBD on board than a Percocet.
That's kind of what that's what I'm thinking too. Like
Yeah.
you take these
But
opioids.
the PSWs have to be, they are in an awful difficult position because a lot of them really have to work, and a lot of them have two jobs. They have a nursing job and then they have another nursing job, or they have some other job as well. They're working 16 hours a day, and
Employers aren't they just aren't. No employers have ever really been understanding, so it's not just the PSW thing,
yeah.
commercial world, but yeah, you're exactly right. And there should be allowances made. But I think you hit it on the nail. The key here is communication. If this is something you're doing, you need to communicate with your employers, be forthright, and going back to that, removing some of the stigma ahead of time. If you're going to be going to doing this, making sure that it's embraced, it's approached from a medical point of view.
Yeah, yeah. Otherwise, they could have terrible stress from, worrying about their employer
Well, exactly.
finding out, or the attitude of the employer who might think that this is a dangerous narcotic, which it is not. I think as time goes by, the employers will get used to the idea that this can benefit people and allow them to work comfortably because they are going to work. It takes an awful lot for a PSW to stop working.
It's well, exactly. They are
Yeah.
back on their own. This is many live paycheck to paycheck. Most of us do these days. A lot of us do. Um, but I mean, you need to keep working, and if you can't take a narcotic, which you shouldn't be taking because you can't drive on a narcotic, so you can't do that. They're really down into a narrow area what they can actually get relief from. So yeah, we definitely will be communicating more about this to our membership going forward as an alternative. Something about self care, I think, is important. Um, Professionalism and advocacy. So, um, actually, I just talked about this. Education reduces stigma. Yeah, this is exactly the point. We really want to make sure that we, as the association, work with Apollo Clinic because I know we're starting to work together now more formally, and we really want to start making sure people understand as an association that if you're going to be looking at that you look at medical cannabis and making sure that we don't confuse the medical process with the desire to self-medicate because it's so accessible and just picking CBD off the shelves and trying. So how do we so I have a real world example for you because we have a lot of comments here, but we're running short on time. Sorry, doctor. Um, let's give a real world example. A PSW is supporting a client in home care who uses prescribed cannabis oil for chronic pain and sleep. The family asks for PSW help to administer. What should the PSW confirm?
Okay, it's a good start that they're already using prescribed cannabis
It is,
and the
yes.
family is up for it. Yeah, the family has undoubtedly tried to administer the cannabis oil already and maybe had a little trouble with it. So I think it's good if the PSW can find out how to do it. Cannabis oil is often given to children with autism, and uh, the idea is to sort of sneak it in. And my favorite thing is to mix it with Nutella because almost no child can say no to Nutella. But first of all, you might think, is the oil what you want, or would they be okay with a gummy, which is very easy to use, as long as you keep them hidden because they look like candy. So sometimes you have a situation where you got to put the oil in a G tube, something like that. Families get very good at this, or you have to mix it with some juice or some yogurt or something like that. So it's good if the PSW knows a little bit about how to do the oil. The oil is the tricky one because a gummy you can just chew it up. I talked to a lady yesterday who cut a gummy into 6 pieces every single time and snuck. I mean, these are not very big, right?
Oh, it's like
She gave her
rest.
kid 1/6 of a gummy every time,
Oh,
and that seemed to work. But you don't have to do that. So I think it's basically you have to go over it, make sure you've got your household organized so the supply is there, so it's safe. You're not going to run out, and go over what are the directions? What's the prescription? Is it 0.5 milliliters? Are you titrating? What are you doing? And the PSW has to know how to measure it if you're measuring it. So a lot of the oils come with little droppers, like a syringe.
yeah.
And the PSW, I assume, knows how to take up something in a syringe and measure it, like to one
Oh,
milliliter.
yes.
Whatever. Yeah,
Yes.
so they know that. And the PSW needs to say that she understands, she or he, that she's going to keep an eye on their level of consciousness, whether they're dizzy, whether they're sneaking something else or sneaking more of the oil, whatever, that she's onto it and that she's the one who's going to be giving it and not the patient's friend or granddaughter or whatever. People do all kinds of things because they mean well, but
You've hinted at that throughout this conversation, Doctor, about hiding things, and yeah, it's an interesting dynamic that you have to worry about. People trying to take it. That's fast and interesting. So,
yeah, it's really safe. So we're talking about all these cautions and that, but very, very little goes wrong with this. I think the main thing that might go wrong is that you're not getting enough, or it's not working, or there's just too much else going on. But
do you
the product itself, the CBD, is what you're mainly going to use, is very, very safe.
do you think people get an expectation, like when they hear that they're going to get cannabis and they get CBD, that they're expecting to get high and therefore they want more because they're not getting that? Is that something that you might encounter?
That might happen. Yeah,
Yeah, okay. I was
yeah,
just wondering if that's something that people are like, well, I'm not stoned. I'm like, well, you're not supposed to be. This is an anti-inflammatory direction, not
yeah,
a
yeah.
psycho.
And the PSW can also say, if it's somebody with arthritis, why don't you get some of the cream and put it on those fingers, put it on a small joint, that kind of thing. There are different ways to give cannabis that can be quite cool. You
Yeah,
know,
interesting.
you know, there's sprays. They've got a spray. There's a THC spray that the autistic children's parents use to calm them down if they're totally wild and tearing the house apart. They spray it on them, and
Wow.
one dose, and they calm. I don't know how it works, but
I don't know how I've
yeah,
never heard of a spray. That's the first time I've ever heard of
yeah,
it.
yeah. There's funny little things like that.
It's fascinating. So we're gonna just into our closing element, and thank you for providing so much information. But um, do we have any questions? I think we've given a lot of information, and I don't think I have any questions. But one of the questions I mean we work with is at least as an association is doing deprescribing. And one of the elements we have, and I think this ties in a little bit, is trying to um, like we talk about, people in long-term care are really heavily prescribed. This might be an alternative for them to investigate, especially if they're dealing with pain. So it's good to know about the alternatives for sure.
Yeah,
Um,
that's huge. That's huge. The older people are coming in with 8 or 10 different medications that
that
the doctors totally lost track of, and
and then they so
can
that's
get
why
rid
we
of some.
recommend when you enter into a long-term care facility or when you leave a hospital, you should be getting medication reviews regularly to make sure that all your medications. Would you agree with that? Like relative,
Yeah, yeah. You can get medication reviews done all the time, even at
yeah.
your drugstore.
But they don't
Um,
do them. Like it doesn't seem to be a
yeah,
standard practice, but it's becoming more
mm,
so. So that's the concern
yeah.
that I've seen as the
But
association.
then you have to. It's important to imagine that the person doing the review has some appreciation of the place of the medical cannabis in this cocktail of medications, because otherwise they'll be told, you shouldn't be taking this stuff, it's poison, or some fool thing.
No,
you know,
exactly.
yeah,
I think there's a lot of room for discussion when we because we do work with de-prescribing, um, and prescribing antipsychotics and long-term care is another issue that we've been working
yeah.
with. This doesn't, I don't think cannabis would tie too much into being able to alleviate antipsychotics in this situation, but when it comes to the other
It
element,
has it has anecdotally, it has
has it?
anecdotally
Like
that
so,
it calmed people who used to need antipsychotics. But the literature on it is all over the map, I have to say. It's going to take time to sort that out.
yeah, because we
I,
just
I think you will be able to de-prescribe antipsychotics in long-term care if you use
I
this properly.
yeah, I think that's I think one of the goals is there's a lot of we obviously reducing comorbidities would be a nice thing too. If this is any play can play any role in that would be helpful as well. But I'm not sure if we're even close to that at this point. We're very much early in this. Um, so how do people reach so if I'm a PSW and I'm in Ontario, where can I find an Apollo clinic? Um, for any PSWs listening right now and you're dealing with pain and you want to explore the CBD element and doing this properly with a medical, how can they contact the Apollo clinics? I know it's online.
Okay,
Provide
yeah.
links.
Just go to their website. It's Apollo Cannabis Clinic, and it used to be called Apollo Applied Research. The couple little research trials going on. So go to the website. The visit can be in person or online. I think the way to go is online. You get a Zoom call. Right now, I do all the autistic children visits by phone because dragging a child to a clinic or even in front of the video, it's not worth it. It's really hard on the parents.
It's
So,
and the
but
person don't want to do it. I get it.
it was so stressful when they used to come into the clinic. Sometimes I've had visits where I had to do the visit in the parents' car because they couldn't get the kid out of the car. But so the phone is lovely. But Apollo Clinic will do video, and they can do this all over Canada. They've got people all over Canada, and they have nurse practitioners as well as doctors. And nurse practitioners are very good at this.
We
They
work closely. Yeah, we
very,
work.
yes, this is terrific. Quebec, everywhere. So you just get on their website, and they will book an appointment. And I imagine the other cannabis clinics would do that as well. If their doctor says, well, I want to do it myself, um, and not go to a clinic, well, then you lose the advantage of the educators who figure out all the nitty gritty and solve the problems. But you can go to the website of a licensed producer, um, Emblem, Canopy Growth, whatever, Aurora. They change all the time,
They
and
change. Yeah,
download the prescription form and email it in or fax it in. But
that's
then you don't get all the helpful hints and that,
no.
you know.
And I think your point about, and I think we've touched on a lot, is the educator's role in that individualized care element when you're doing if you're looking for that prescription element. That's nothing to be sneered at. That seems to be a very vital thing in connecting the
Yeah.
dots in this. So, if you're looking, I would advise any of our members please look to Apollo Clinic. So if you're in far north, for those of us who live far north Ontario, I live in the south, but for those who live in the north, it is accessible. We have the good Dr. Williams, who's been an amazing guest this morning, and I really appreciate you coming today and telling us all about this. I'm hoping to have you back. There's a lot of areas here I'm sure that we can continue to discuss, especially as we try to promote alternatives to pharmaceuticals in long-term care and a lot of the issues that are dealing with quality of life especially in that sector, be it retirement, home, or long-term hospital. So a lot of intersecting issues, and hopefully, in time, well, this will continue to play a bigger role in mitigating some of these issues. That would be wonderful.
I should. Well, thanks for having me.
Dr.
It's
Williams,
fun to talk about it.
it's a lot to talk about. It's an area, and again, we're just at the beginning of this historically coming over out of this the stigma that used to be associated with it. I think when I was a child, it was absolute no, it was bad, 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 and now we're in a complete opposite. So we're getting there. We'll get there
Yeah.
for for sure.
Yeah, maybe someday I'll try it. I don't know.
Oh, it's up to you, doctor. I think it's always good to have someone clinical though, and analyzing it and
Yeah,
keeping a steady analysis is always important for sure. So
yeah, yeah.
I
People do say, well, I don't want to do it because there's no research, but there's lots and lots of research now, and studies are getting better and better, but uh,
well,
still a long ways to go. A lot of that
just
research was done in Europe or overseas because the Americans, they still think it's a narcotic, so they couldn't study it. So, but
fair enough.
we have lots of good research coming. Our clinic has done a little bit. Um, we did the one with the chronic pain where people stopped using opioids and dropped their doses. It was
Yeah,
fantastic to see that happen.
I'd like to learn more about that one specifically because I think that one is important. Opioids, they worry me. I think they seem very dangerous, and any alternative is good to know about for sure.
Yeah, it's
Sure.
on their website. Yeah.
We've got to get them up.
Yeah.
I hope you can visit us again and definitely love to learn more about this. And I'd like to thank you again for coming today. And if anyone at PSWs have questions, please look at the Apollo Clinic if you're looking to do CBD and pain management, especially if you're working with chronic pain. Please contact Apollo Clinic. Get the educator. Make sure we do this medically and appropriately, and safely is always the best thing. Dr. Williams, I'd like to thank you again for coming this morning. I hope you have an excellent weekend and keep up the great work. And I hope we can meet again.
Okay, for sure.
All right.
Thanks.
Have a lovely weekend.
Yeah.
Take care. Bye bye.